all of you joining us for the first time. The White Rose community is a menopause wellness community where we're going to help women to navigate all of the symptoms of menopause, making it much easier to handle and to get through it. I'm Dr. Zainul Khan. This is Nurse Maria Nurse. Sorry for the delayed evening. As mentioned, we were setting up this evening and we got a little bit of a late start. But tonight's topic, we're going to just dive into uterine fibroids and how it affects you during menopause. If you have any questions, raise your hand. I'm going to be off camera. Or just click on the chat and post your question, and I will highlight it for Maria to answer. And then let's get going. All right.
All right. So our topic is generally what we're doing is, as Dr. Khan said, fibroids, uterine fibroids, and we're going to an overview of it. I'll just go into a definition as I'm starting up. Uterine fibroids are a common type of non-cancerous tumors that can grow in and on your uterus. Not all fibroids cause symptoms, but when they do, symptoms can include menstrual bleeding, back pain, frequent urination, pain, and generally pain during sex. Small fibroids often don't need treatment, but larger fibroids can be treated with medication. So we are going to deal with the symptoms and causes, diagnosis and tests, management and treatment, prevention / outlook, prognosis, and living with fibroids as well. So what are uterine fibroids? Now, it is important, ladies, as we're going through this topic, is if you have a pen and a paper, you could write out some of the terms, some of the things that you may need to keep, so that if when you go to the doctor, if this is your issue, or if you know anybody with this issue, you can give them some information, and they can, so they would have the questions to ask the healthcare provider or specialist to help them with their particular issue, if it's particularly fibroid, right? What are uterine fibroids? Uterine fibroids, also called leiomyomas, are growths made of muscle and tissue that form in or on the wall of your uterus. Now, these growths are usually not cancerous, and non-cancerous growths we call benign, and are the most common non-cancer. Pardon me? Miss Sati? Something. I was saying something about Miss Sati was saying something just now, and then it just went. Sit down.
You should go to here.
Can I say it now? I was hearing her good, and then it just cut.
Ask if everybody's hearing it.
Everybody hearing now? Okay then, good. Right. And Miss Ati, you were saying something just now? Okay then, very good. Right, so these growths are usually non-cancerous, benign, and are the most common non-cancerous tumor in women all over the world. Uterine fibroids can cause a variety of symptoms like pain, as I said, pain, and heavy irregular vaginal bleeding. Sometimes a person has no symptoms and is unaware that they even have fibroids. The treatment for fibroids typically depends on the type of symptoms that you display. Where do fibroids grow? Fibroids can grow as a single nodule, which is one growth, or in a cluster. Clusters of fibroids can range in size from 1 millimeter to more than 20 centimeters, which is 8 inches in diameter, or even larger. For comparison, fibroids can be as small as a seed or can get as large as a watermelon. These growths can also develop within the wall of your uterus, inside the main cavity of your uterus, or on the outer surface of your uterus. The uterus and womb is the same thing. Types of fibroids. There are different types of fibroids depending on where they are located and how they attach. Specific types of uterine fibroids include intramural fibroids. These are the ones that are embedded in the muscular wall of the uterus. They are the most common type. We have the submucosal fibroids. These fibroids grow under the inner lining of your uterus. The subserosal fibroids. This type of fibroid grows under the lining of the outer surface of your uterus, and these are the ones that become quite large and that can grow into your pelvis. Sometimes when I see patients, and sometimes they say, nurse, you can touch it and they feel extremely large, and it can be very, very uncomfortable. We have the pedundulated fibroids. These are the least common type. These fibroids are attached to your uterus with a stalk or a stem. They are often described as with a stalk, like an attachment, like a root, and a stem, so they are attached, right? And they are often described as mushroom-like because they have a stalk and then a wider top. So down below looking like it's stuck on something, and then the top is just spread out. So that is why they call it, they say it's like a stalk, and it spreads out like a mushroom at the top. But these are the least common type. Are fibroids common? Fibroids are a very common type of growth. Approximately 40 to 80% of people with a uterus have fibroids. They occur most often in people between the ages of 30 and 50 years old. People who haven't had their first period yet typically don't have fibroids. That's young girls. They are also least common in people who've entered menopause. Because why? We'll learn that as we go on. Symptom and causes of fibroids. What are the symptoms of uterine fibroids? Most fibroids don't cause any symptoms and don't require treatment. Other than regular observation by a healthcare provider, larger fibroids can cause you to experience a variety of symptoms, including excessive or painful bleeding during your period, bleeding between your periods. So your period has stopped and then you get a little pause and then the bleeding comes again. A feeling of fullness in your lower tummy or abdomen, and that feeling of bloating, right? That is very common. Frequent urination. This can happen when a fibroid puts pressure on your bladder. So if you note these structures, right? You have the bladder in the front, the uterus in the middle, and then you have the rectum to the back. So if there is this growth there in the uterus, it could put pressure either in the front, where the bladder is, or to the back, where the rectum is, causing a lot of discomfort in those areas. Hence the reason why you may go to the bathroom more often than usual, because of the pressure that the fibroid puts on these two organs. Pain during sex. Again, that has a lot to do with the size of the fibroid as well. So it would be painful during having intercourse. Low back pain, another symptom. Constipation or feeling pressure in your rectum. That's because of the size of the fibroid, where it's located, and that could cause pressure. So remember I said, so you have the bladder in the front, uterus in the middle, the rectum to the back. So once this fibroid starts to grow, it can cause stress in these two organs that is it's so close to. Long-term chronic vaginal discharge. Yes, a lot of the ladies, when they come to me, they say, Miss, I seen an unusual discharge. We get a pap smear done, and basically they tell me, well, yes, I have a fibroid. So the fibroid lets out a very, what we call weep, a kind of weepy, kind of yellow straw color discharge. It lets that out chronically. It comes every like a period finish, and then this set of wetness, very uncomfortable, and so that comes from the fibroid itself. The inability to pee or completely empty your bladder. Well, we know again, because of the size and the pressure that the fibroids place on the bladder, you go to pee and you cannot empty all the pee because of the pressure that the fibroids places on the bladder, and so it might cause a little, probably say a little, it might block certain parts so that all the urine cannot pass out. So some would remain, and you know that could cause further problems like urinary tract infection. You could get in bladder infections with that remaining pee that is not coming out, urine. Increased abdominal distension, which is enlargement, causing your abdomen to look like you're pregnant. Has anyone ever seen that, experienced that? No. Yeah. Now, the symptoms of uterine fibroids usually stabilize or go away after you've gone through menopause, because hormone levels decline within your body, because we know that the estrogen and the progesterone, they feed the fibroids along with a good blood supply. What does fibroid pain feel like? There are a variety of feelings you might experience if you have fibroids. If you have small fibroids, you may feel nothing at all. Some people have them and they never know they have a fibroid until they go and do an ultrasound or get a checkup, and then the doctor would tell them, you know, you have some small fibroids, and they would say, well, I never knew, because they actually have no symptoms. Now, for larger fibroids, however, you can experience discomfort and pain. Fibroids can cause you to feel back pain, a stabbing pain in your abdomen, and even pain during sex. I've known patients say that get up in the morning and they start to stretch, and as they release their arms, they feel the stabbing pain in the lower part of their abdomen. Or, you know, sometimes they lie in the bed and they turn and they try to stretch again, they get that pain in that lower part of the abdomen. So that is a very discomforting. What do fibroids look like? Fibroids are typically rounded growths that look like smooth bumps. In some cases, they can be attached with a thin stem, just as we talked about just now, giving them a kind of mushroom-like appearance. What causes uterine fibroids? The exact cause is unknown by healthcare providers. However, it is believed that the hormones estrogen and progesterone play a role, a very important role. Most fibroids happen with women in their reproductive years. Studies show that fibroids tend to grow when hormone levels are higher. Like during pregnancy, sometimes a woman would have a fibroid growing alongside the baby. And there are fibroids that shrink when hormone levels shrink, or when hormone levels are low, like during the transition to menopause. What are the risk factors for uterine fibroids? there are actually several risk factors that can play a role in your chances of developing fibroids. These can include a family history of fibroids. Your granny had it, you have aunties that have it, sisters have it. Could make you more prone to getting fibroids. Obesity, and a higher obesity as overweight, and a higher body mass index. Pardon me? Okay. Yeah, obesity and a higher body mass index are some of the risk factors for developing fibroids. Not having children is another factor. Early onset of menstruation, getting your period at a very young age. Late age for menopause, you're going through menopause at a later age, makes you more prone as well. What are the complications of uterine fibroids? Most uterine fibroids don't cause serious complications. However, the most common complications of fibroids are, pardon me? The most common complications of fibroids are pain that becomes unmanageable. You're having this pain, even though they say it may be not an extremely big fibroid, but that you're having a pain that it is unbearable, it is affecting every aspect of your life. You get up in the morning, you can't get out of bed, you know, it's painful. Swelling of your abdomen or pelvic area. I have known women, and even up to this point in time, have swelling of the abdomen or pelvic area, and they are not going to get that fibroid taken care of. They are afraid, right? So it causes a very large abdomen, and that depends on the size of the fibroid as well. So you'll get swelling of your abdomen and pelvic pain, and swelling of the pelvic area. Excessive bleeding. I think this is one of the most distressing things about fibroids, that bleeding, that continuous, excessive, heavy bleeding. You cough, you're feeling the blood gushing down. You laugh, you feel it gushing down. You make a little move, it gush. It messes you up. Sometimes you cannot go to work. You're home just changing pads, and you're changing the ink pad. You have to protect the bed. You're messing up your clothes. Excessive bleeding. That excessive bleeding can lead to problems like anemia. You get a low blood count now, and that could lead to other problems. So it is definitely, you know, it reached that point, you really need to get medical help. And symptoms, again, another symptom, infertility. Now that infertility can depend on, it definitely, we know some women get pregnant with fibroid, but the infertility can, with some cases, is where, or the location of the fibroid. Now this infertility during with fibroids is actually a rarity. Yeah? It is not as common as some people think. So the anemia is a condition that happens when your body doesn't have enough healthy red blood cells to carry oxygen to your organs. Anemia can happen to people who have frequent or extremely heavy periods. Fibroids can cause your periods to be very heavy, or for you to even bleed between periods. Talk to your healthcare provider if you're experiencing symptoms like anemia once you have fibroids. Do not leave it unchecked. There are certain diagnoses and tests to know if you actually have fibroids, or if it's it may be another type of growth, but it is important to have these tests done to know what you are dealing with. So in many cases, a healthcare provider discovers uterine fibroids during a pelvic exam. So the healthcare provider, the doctor, the nurse, they touch and they feel this lump or number of lumps in their pelvic area. Quite often, heavy bleeding and other related symptoms may alert your provider to consider that it may be a fibroid as part of the diagnosis. However, there are several tests that can be done to confirm if they are fibroids and determine their size and their location. These tests can include ultrasound, ultrasonography. This is a non-invasive imaging test, creates a picture of your internal organs with a sound wave. We know ultrasound is one of the most tests they commonly do. Then we have MRI, which it creates a detailed image of the fibroid and your internal organs. It may show where it is attached to. You have the CT scan, which uses X-ray imaging and to give you a detailed image of the fibroids and the organs and at several angles. Hysteroscopy. Now, during a hysteroscopy, your provider will use a device called a scope, a thin flexible tube with a camera at the end to look at the fibroids inside your womb or in your uterus. The scope is passed through your vagina and then into your cervix, then moves into your uterus. You have the sonohysterography. This is another form of imaging or test. Your provider places a small catheter in your vagina and then injects something called some saline into your uterus. Now the extra fluid helps to create a clear image of your uterus and would let him see that you would usually see better with this imaging than a standard ultrasound. Then you have the laparoscopy. During this test, the provider will make a small cut, a small incision in your lower abdomen. A thin and flexible tube with a camera is attached to the end and is inserted to look closely at the organs as well, the internal organs, and where the fibroid may be attached to as well. Management and treatment. How are uterine fibroids treated? Treatment for uterine fibroids can vary depending on the size, number, and location of the fibroids, as well as what symptoms they may be causing you as a patient. If you aren't experiencing any symptoms from your fibroids, you may not need treatment. Small fibroids can often be left alone. Some people never experience any symptoms or have any problems associated with fibroids. In some cases, though, your provider may recommend monitoring your fibroids with pelvic exams, like what we described just now, or ultrasound, etc., if you're experiencing symptoms from your fibroids, including anemia, which is from the excessive bleeding, moderate to severe pain, or urination tract or bowel problems, you will need treatment to help those symptoms. Your treatment plan will depend on a few factors, including how many fibroids you may have, the size of your fibroids, where your fibroids are located, what symptoms you're experiencing related to the fibroids, and if you have a desire to keep your uterus or not. Now that part there depends on the age of the client and the severity of the symptoms as well. So that is something that they would take under advisement of the doctor and eventually decide what is best for them according to the symptoms they may be displaying. The best treatment option for you will also depend on your plans for pregnancy in the future, things like that. So it is important to talk to your healthcare provider about your fertility goals when discussing treatment options. Treatment options for uterine fibroids can include medications, over-the-counter medications, pain medications to manage the pain and discomfort caused by the fibroids. So over-the-counter like acetaminophen, ibuprofen. Iron supplements. If you're having problems like anemia from the excessive bleeding, your provider may also suggest you take an iron supplement with control pills. is another option, ladies. Birth control can also help with the symptoms of the fibroids, specifically the heavy bleeding during and between periods, and also it could cause menstrual cramps. There are a variety of birth control options you can use, including the oral contraceptive pills, the rings. The doctors usually put in that one, the rings. We have injections. You can get that from the doctor or from the nurse. Intrauterine device where people like me can come in and put in a IUD with low dose hormones, which helps to regulate the bleeding, and that is very helpful for a lot of women. We have gonadotrophin relieving hormones, which are agonists. These medications work on shrinking fibroids. They are sometimes used to shrink a fibroid before surgery, making it easier to remove the fibroid. However, these medications are temporary, and if you stop taking them, the fibroids can grow back. Oral therapies. It has an oral therapy medication that they call elastogolix. It is a new oral therapy to manage heavy uterine bleeding in people who haven't experienced menopause with symptomatic uterine fibroids. It can be taken for up to 24 months. So this is something you can talk to your healthcare provider about. It has its pros and its cons, so you have to discuss that in detail, because we know some of these things have a lot of side effects, and according to what you are going through, it may be good for you, it may not be the best option for you as well. Right? So that is important. It is important to talk to your healthcare provider about any medications that you are taking. Always consult your healthcare provider before starting any new medication to discuss the possible complications. Now we want to talk about fibroid surgery here now. There are several factors to consider when talking about the different types of surgery for fibroid removal. Not only can the size, location, and number of fibroids influence the type of surgery, but your wishes for future pregnancies, if you're within that age, that fertile age where you are thinking about having babies, you would want to conserve or keep your uterus. If you are at that point in your life where you say, look, I have all my kids and this thing is really killing me, it's really debilitating, I really can't function, and a removal of your uterus, which is a total the hysterectomy, may be an option as well for somebody like that. But that depends on the individual and their symptoms and what they're going through. Some surgical options preserve your uterus and allow you to become pregnant in the future, while other options can either damage or remove your uterus. The myomectomy is a procedure that allows your provider to remove the fibroid. There are several types of myomectomies. The type of procedure that may work best for you will depend on where your fibroids are located, how big they are, and how many you have. The type of myomectomy procedures to remove fibroids can include the hysteroscopy. Your provider inserts a scope and it goes through your vagina into your uterus, and the scope is used to cut away or remove fibroids. The laparoscopy. In this procedure, your provider will use a scope and remove the fibroids. Unlike the hysteroscopy, this procedure involves placing small incisions in your abdomen. This is how the scope will enter and exit. Right? That is what makes this one different from the other procedure. A laparotomy. During this procedure, your provider makes one larger incision in your abdomen and removes the fibroid through that one cut. If you are planning future pregnancies, there are additional options your healthcare provider can recommend. These options may be very effective, and some do, but they may typically prevent future pregnancies, and some of these include the hysterectomy. The hysterectomy, as we know, removes your uterus during this procedure. The hysterectomy is the only way to cure fibroids, by removing your uterus completely. The fibroids can never come back and your symptoms go away. If your ovaries are left in place, you won't go into menopause after having this procedure done. However, this procedure might be recommended if you're experiencing very excruciating pain and extremely heavy bleeding from your fibroids, or if you have large fibroids. So it has to be the extreme for them to do a procedure like this. Minimally invasive hysterectomies include vaginal, laparoscopic, and something called a robotic method. These are new. This is one of a newer method that is available now. Not too sure if it's available in Trinidad and Tobago right now, but it is available in some countries. Uterine fibroids embolization is another option women have. It is an interventional radiologist who performs this procedure with the help of a gynecologist. They put a small catheter in your uterine artery or your radial artery and inject small particles which then block the flow of blood from going to that artery that feeds the fibroids. Loss of blood flow shrinks the fibroid and improves your symptoms. This procedure may not be right for everyone. Radiofrequency ablation, they call it RFA for short, is another procedure. This is a safe and effective treatment that uses microwave energy to treat uterine fibroids. It's recommended for people who haven't reached menopause. It treats smaller fibroids. Risk to uterine fibroid treatment. There can be risk to any treatment. Medications can have side effects, and some may not be good fit for you. So therefore you have to talk to your healthcare provider about all medications that you may be taking for other medical conditions. Probably you might be hypertensive, diabetic, you may have thyroid problems or issues, and maybe on medication for things like heart problems. All of these things need to be discussed along with the care that you may need for fibroids, and a complete medical history before even starting any new medication. If you experience any side effects after starting a new medication, call your provider to discuss other options. There are also risks involved in surgical treatment of fibroids. Any surgery places an individual at risk of infection, bleeding, and includes risk associated with the actual anesthesia. An additional risk of fibroid removal surgery can include future pregnancies. So sometimes, according to the type of fibroids you have, it may decrease your chances of getting pregnant. Some surgical options can prevent future pregnancies. Myomectomy is a procedure that only removes the fibroids, allowing for future pregnancy. So the fibroid is removed and gets out of the way, and you can still become pregnant. However, people who've had a myomectomy may need to deliver their babies through a C-section because it becomes more difficult to push that baby out because of the procedure. But they can get pregnant. How large do uterine fibroids need to be before being surgically removed? There isn't a definitive size of a fibroid that would automatically mean it needs to be removed. Your healthcare provider will determine if surgery is necessary based on the type of symptoms you are displaying. For example, if fibroids the size of a small marble may still cause excessive bleeding depending on their location. And remember, we spoke about that earlier. Sometimes you have a small fibroid, no problem, and then you have a small fibroid and is located in an area where there's a good blood supply and it causes a lot of problem. Your healthcare provider can discuss symptoms that might require surgical intervention. What happens if fibroids go untreated? If you don't have symptoms, treatment for fibroids may not be necessary. If you have large fibroids or symptoms are causing you pain and discomfort, getting treatment may be the best option for you. Only you and your provider can decide the best course of treatment, or if treatment is necessary in the first place. Prevention. Can fibroids be prevented? In general, you cannot prevent fibroids. You can reduce your risk by maintaining a healthy body weight and getting regular pelvic exams. If you have small fibroids, develop a plan with your healthcare provider to monitor the fibroids to see if they are growing, to monitor what if you're having symptoms and things like that. Now we discussed the outlook of our prognosis. Can I get pregnant if I have uterine fibroids? Yes, you can get pregnant if you have uterine fibroids. If you already know you have fibroids, when you get pregnant, your healthcare provider will work with you to develop a monitoring plan for the fibroids. During pregnancy, your body releases elevated levels of hormones. Now these hormones support the pregnancy. However, they can also cause your fibroids to get bigger. Large fibroids can cause the following problems during pregnancy. Some of the problems can include an increased risk for a C-section delivery because the fetus cannot flip, or as we say move, or the head cannot get into position. So the only way to get that baby out is through a C-section. Your labor does not progress. You're going through labor and you're not progressing. That is another problem with the fibroids during pregnancy. Placental abruption or ruptured placenta is an emergency that could kill the mom and the baby. So it's something that needs to be monitored. Preterm delivery, another issue that fibroids can cause. You deliver your baby before time because of the size of the fibroids and the problems it may be having on the pregnancy. Can fibroids change over time? Fibroids can actually shrink or grow over time. They can change size suddenly or steadily over a long period of time. This can happen for a variety of reasons, but in most cases, this change in fibroid size is linked to the amount of hormones in your body. When you have high levels of hormones in your body, fibroids can get bigger. This can happen at specific times in your life, like during pregnancy. Fibroids can also shrink when your hormone levels drop. This is common after menopause. Often your symptoms can also get better after menopause. Will fibroids go away on their own? Fibroids can actually shrink in some people after menopause, ladies. This happens because of decrease in hormones. When the fibroids shrink, your symptoms as well go away. So small fibroids may not need treatment excuse me, if they aren't causing any symptoms, because eventually they will go away. Do fibroids make you feel tired? Feeling tired isn't a common symptom of uterine fibroids. However, it is a common symptom of anemia, that is the heavy bleeding, which can occur when you lose too much blood. So therefore you have to talk to your healthcare provider if you are excessively tired, to determine what course of treatment you can get. Well, we know that do fibroids make your stomach big? Yes. It's possible that large fibroids can cause your stomach to bloat and appear large. How do you live with fibroids? When should I contact my healthcare provider? Contact your healthcare provider if you have symptoms like heavy and irregular vaginal bleeding, bleeding in between periods, the period stop and another period come back again, heavy bleeding contact your healthcare provider for cases like that. Pelvic pain, that excruciating lower abdominal pain, you know you have fibroids and this pain just keeps coming back, it's excruciating, you need to see a healthcare provider. Pain during sex, that could be a problem for both you and your spouse. You need to get that checked out, go to your healthcare provider. A feeling of pressure and fullness in your belly, you need to see your healthcare provider as well. Now, because these symptoms are common symptoms and of other it could be other gynecological conditions, discussing them with a provider, healthcare provider, is important, ladies. A fibroids cancer, it's extremely rare for a fibroid to go through changes that transform it into a cancerous, which is a malignant tumor. In fact, 1 out of 350 people with fibroids will develop cancer. There's no test that's 100% predictive in detecting rare fibroid related cancers. However, people who have rapid growth of uterine fibroids or fibroids that grow after menopause should be evaluated as soon as possible, ladies. So, uterine fibroids are a common condition that many people experience during their lives. In some cases, fibroids are small and don't cause any symptoms at all, and other times, the fibroids can cause challenging symptoms like pain, heavy vaginal bleeding. Talk to your healthcare provider if you experience any kind of discomfort, pain, or anything debilitating. So that's the end of our topic, ladies. I know you all have a lot of questions, you have comments, anything. The line is now open. Or what? Yes, who? Wondering, you having any symptoms, Amril? You having any pain or discomfort or anything like that? The lower back pain. And how long you having that lower back pain? What I suggest is still go to your healthcare provider and see what they have to tell you. Go with your results and talk to your gynecologist and see, because you need to rule out what causing this back pain in the first place, right? Because remember, location is important, the location of the fibroid. Just go to chest check, just to make sure. I always say prevention is better than cure. And if he tell you, just observe it and see what's going on, or you know whatever they discuss your symptoms, your history, and you can have a plan of care to see what might be the best option for you. So you need to go and see your gynae. I would not suggest that you stay away and just look and if you don't want to do that. So just go to them, go to your gynae and just check it out. Just to make sure. I don't think it will hurt. Just a little, you might just have to pull out a little more cash, but you know, it's be for your general good. Yeah, check it out. Yeah, go and check it out, because as we was discussing earlier, we know a lot of these things too. You had to change your diet. You know a lot of the food we eating now is just crappy. You know, it doesn't have what it has, at least what it had in our grandparents' time. The yeah, the quality of food, so we getting more a lot of these things more readily, and we're suffering more because of the type of food. You know, we're not getting the amount of minerals, vitamins in our body to fight off a lot of these things. So you need to go and just find out if you can take something to help you. You know what it is. Whatever plan of care you and the healthcare provider discuss. Miss Sati, I see you come up. Mhm. 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 Yes. Okay. From what I've known, some women say they go through menopause and they feel this thing come down. Bloop. Some women own would actually shrink to the point and even come out, and some women own will just shrink and just get extremely small and not be an issue again, because there is the estrogen and the progesterone. But to say like totally, if I could know if it will totally disappear altogether from, with some women I think it would totally shrink and fall out, and with some women it might get extremely small and insignificant, no symptoms, and it would just probably just extremely small. But to say like I cannot 100% say it will totally with all women not totally disappear from the space, because remember it needs estrogen, progesterone, and a good blood supply, right? Mhm. Mhm. Yeah, yes, yeah. Um, it depends. It de- all right. It depends. In my practice as a sexual health nurse, midwife, family planning nurse, I would see more women getting, because of the area I am in. So I could really talk about the area I am in at this point in time, which is the doing pap smears. You would find that you would find more women getting cervical cancer more readily than you're getting a fibroid that is turning into cancer. Because as I was saying in the reading, as in the lesson, as I was saying in the educational part of our discourse just now, if you have a fibroid, you didn't know you had one, and then you find this thing just growing quick, how this thing growing quick so? Because you know fibroid is not supposed to be growing. Last month you find it was a certain size, and then this month you find your belly twice the size. That could be an indication that it could be something cancerous. So get that checked out as quick as possible, right? In terms of cancers, we know that post-menopause, we are more prone to getting cancers of the cervix, the uterus, the vaginal areas. We know that the estrogen and the progesterone plays a role in keeping us very healthy because they both have their functions as the hormones, but when they are decreased, we are more open to get other ailments beside the cancers. You know, we have a problem with our bones beside the cancers. We have a lot of issues, but cancers, yes, yeah, you're more prone to get certain type of cancers. Postmenopausal, it is a time where self-care for us ladies should be the priority. So yes, you have to take more care to make sure that these things don't develop. I hope that answers the question. Well, you know, yes. To do and to stop pap smears. All right. We have a general age group for pap smears. Generally from 21, the age of 21 to the age of 65. However, there are cases in which you come and you might have concerns to do a pap smear. Example, if you know that you're past your menopausal time and bleeding starts back, whether it's maybe spotting, you go to your healthcare provider and they would send you, let's go check to see what causing this postmenopausal bleed. It may not be cancer, it could be some other issue going on with your body. It could be something hormonal, something that is not a rare, something that is going on. You're just checking to make sure. The age group is, yes, it's 21 to 65, but again, we tell a lot of the young ladies under 21, once they're sexually active, remember, HPV, which is the human papilloma virus, is linked certain numbers of the HPV, not all the HPV viruses. There are certain numbers of the HPV, I believe 14, maybe 118, and other different numbers cause cervical cancer. So, once you're sexually active, you have multiple partners, I advise young ladies, even before the age of 21, talk to your healthcare provider, get a pap smear done, because remember, the HPV is would cause changes in the cervix that could be precancerous, and if left unchecked, it could eventually turn into cancer. Now, why it is important to get that screening is because it is a very survivable cancer. It actually takes 10 years for cervical cancer to become fully cancerous in a woman that has no comorbidities. Now, if you have comorbidities like you have diabetes and other immuno problems, for example, you may be HIV positive and you may have that, it could fasten the process. However, generally speaking, it takes about 10 years. Now, women after the age of 65 who develop post-menopausal bleeding, it is required that they get a pap smear done to see what is going on as well. So, the two outliers under the age of 21, check the for HPV, make sure it's nothing cancerous, you're sexually active, you have a number of partners, you just want to make sure you check. Even you might be younger than 21, even though 21 is the standard. After 65, you have issues, don't just sweep it under the carpet. Go to your healthcare provider, let them give you a referral, or just walk in where they do pap smears and have a pap smear done. You just want to make sure that you're covered and you're ruling out cancer. Right? I hope that answers the question. Okay, thank you. Any other questions? Okay. What I would suggest though, ladies, if you know you haven't had a pap smear done in a while, I suggest that you have one done, especially, and I've had a lot of patients who, due to the COVID, they didn't come, and it's a long time and they didn't get a pap smear done, and they need to get updated. Come and get your pap smear done. How we get a pap smear done? You're counting 10 days if you see your monthly still, 10 days before your period, 10 days after. No sexual intercourse 48 hours prior the procedure. No douching, so you're not putting up anything there to wash out the cells, because if you do wash it out, we can't see the cells. Hence, when we do the pap smear, no cells there available to send. When we send it to the lab, they can't see anything because they wash away everything, right? And you come and you have your pap smear done, ladies. Encourage women who you know haven't done one to have it done as soon as possible, because it's a very savable cancer. When we catch it in the early stage, you can go back to your normal life, live your normal life, but get it done.